In my world there is music and good vibes and laughter and lovers, adventure and friendship. We know who we are.
Welcome to Be the Wellness Podcast, where we help you master your body, mind, and the experience of life through insightful conversation, interviews with experts and thought leaders, all with a side of marital banter and some good old-fashioned humor.
Yes, we are your hosts, Adam and Vanessa Lambert, and we're committed to helping you live life fully expressed physically, mentally, and experientially. Sit back, grab a cup of coffee, and join the conversation.
Hello and welcome everybody to Be the Wellness Podcast. Adam and Vanessa Lambert and Penelope and Daisy.
Penelope and Daisy in the house. Actually, Penelope has taken residence on my desk permanently.
Yeah.
I've purchased her a little white fluffy princess puff bed, and she's taken to it quite nicely.
Yeah.
Yeah.
It's either that or be on the floor and like complain when we're working late.
Yeah, Penelope is very much engaged with us. So what we're doing, she wants to be doing. Where Daisy's more like, okay, yeah, I'll kick it on the floor like a dog. Penelope's like, no, I like, you're working. I'm sure you're going to need my input. Let me be close by.
I need to be able to see your screen.
Exactly.
Yeah.
Can you screen share that, please?
She's on Slack.
Yeah, she's on Slack for sure. So yes, we are all in the house doing our perfect jobs.
Yes, exactly what everybody needs to be doing.
Exactly. So we've got an awesome guest today and kind of a different topic for us. And we're going to get to that in a moment. But first, we want to give you guys an update about our Montana retreat.
Yes.
We have officially sold our last couples room. So there's now just room for singles or individuals. Or women primarily who want to come. You know, if you have like two friends that want to come, we can put you in the bunk room. So there's still some space in the bunk room, but you know, these spaces are going. So if you are considering that adventure, make sure to get in there and reserve your spot.
Yeah, 100%. It'll be September before you know it.
It will.
And even before that, all the spots will be gone.
Yes, for sure. Everything will be sold before then, for sure. So we're really excited about that retreat. We've got some really cool people coming.
We do.
I mean, it's always cool people.
It's always cool people.
It's always cool people.
We do this every time.
Yeah.
We're like, oh man, this is going to be really awesome because it's everybody that we like. And then you're like, well, that's kind of the case every time, you know?
Yeah, it really is.
Which is cool, but we're pointing it out.
Yes, we like to remember how awesome it is that cool people are coming.
Yeah.
And we'd love to include you in that cool group. So yeah. So anyway, head over to BeTheWellness.com. You can go to our retreats and adventures page and you can see all the listings for everything we have going on. We have space in Montana and a couple of spaces in Costa Rica as well.
Yeah.
So that's what's up.
You can also look at all the things you missed.
Yes. Right.
Which can be fun too. You can pine away.
Yeah, we should have put, instead of like past experiences, we should have put FOMO. Here's our FOMO page. Yeah. So anyhow, check it out. We'd love to get you guys out on an adventure with us and, you know, just fully express yourself out in the wilderness.
In the wild.
Get wild. Yeah.
Get wild.
So anyway, let's get on to our guest today.
Yeah.
Dr. Adil Akhtar is currently Chief Division of Palliative and End-of-Life Care at Michigan Health Professionals and Director of Inpatient Clinical Services. He has a pretty thick stack of credentials, but really what we want to talk about today is an important sort of service that he's providing, and not only like physical service, but I think of this as like a public service. Yeah. And that is really getting people to start to take control of the kind of medical care that they will want to receive, and make advanced care planning more accessible to people. Yeah.
End of life care and advanced directives and all of that kind of stuff is like, you know, people wait until the very last minute to do this. And it's actually a little bit of a pet peeve of mine coming from an industry in the fire service where you deal with this all the time.
Yes.
where somebody is in a bad way, maybe they need resuscitation or whatever, and some family member says, but wait, they have a DNR or do not resuscitate, but they can't produce it. And then some part of the family members disagree, and there's no documentation around it. It's not something that's like known for what to do. And so then it puts everybody in a bind, as far as like, what happens with this person? Do we just let them die, or do we do everything that we can to save their life until they find the paperwork? And that's fundamentally what ends up happening,
Right. And, honestly, this part of what we want to provide, because, this is kind of a different topic for us. Obviously, we mostly focus on health and fitness and well-being. So to focus on sort of end of life or, death seems almost juxtaposed to what we typically cover. But, I really think that living fully expressed includes dying fully expressed.
Yeah, 100%.
And that to complete your life in a powerful and embodied way includes planning for that inevitable moment 100%. That's going to happen for all of us.
It's the one thing that's definitely going to happen.
It's definitely going to happen. And, as much as we like to think it's way, 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 way off in the future, you really don't know when it's going to happen.
It's true.
And to have this stuff dialed in, no matter what age you are, is so important, not just for you, but for the people left behind, for the people that have to make these decisions and, have the hard conversations. It's torturous for them to not know your wishes, to not be clear on what you would have wanted.
Yeah.
And so let's just save our family members. Let's just really take the command of our life story and help them in that piece of your passing, because it will be so much more easy, as difficult of a time as it'll be so much easier if at least that piece of it is taken care of and clear, and they really know what your wishes are.
Yeah, totally. And then that part's a foregone conclusion.
Yes.
There's no decisions. I mean, sometimes there's random decisions that have to be pulled off anyway, but this won't be one of them.
Yes.
You can choose the flowers or the casket or whatever.
Yeah. And for those of you who already have this stuff dialed in, this conversation is still really good, because there might be some things that maybe you haven't thought about, or, we talk about an online service that he hosts that helps to get this information accessible. Like Adam was saying, you might have this stuff like we do currently, and this actually kind of sparked us, where it's in a document in your house. And that's kind of the only place that it exists. So this is about, getting it more accessible to your family members, and really just kind of thinking about this stuff, thinking it thoroughly, thinking it through, so that you can just set it aside and not have to worry about it anymore. This stuff's done and you're good and you can move on.
Yeah. And you can always change your mind.
You can always change your mind.
And that's another thing that's nice about this service that he's providing, is it creates a portal that can fundamentally allow for that. So you can go in and update it, and then, it's always there.
Yes.
Instead of like, wait, that's the old copy.
Yeah,
I know there's a newer one around here somewhere that says do resuscitate. It's like, you want to sort that out. Yeah.
Yeah, no, absolutely. That's a good point. And, I think just listening to him, it's really interesting to hear some of the, sort of emotional blocks that keep people from doing this, or, just even a sense of, not thinking that this will ever happen to you, which is just it's a silly thing, right? Because it will happen to you.
It's the one thing, yeah.
It'll for sure happen. So I really love this conversation, and you'll hear Dr. Akhtar is just he really cares. This is someone who's helping people at the end stages of their life. And I think these people are angels. Honestly, the people who help others transition out of this life is just, that is the work of angels. And so I just really respect and honor what he brings to the table. And I hope that you guys will listen in. And hopefully, if you have this stuff, maybe it'll help you open up a conversation with your parents or your kids or your friends, help people to understand, hey, let's just take control of this scenario and make sure that we're taking care of these specifics.
Yeah. Yeah. And if you really want to turn over stump and look at all the weird worms and stuff that's underneath it, start really thinking about why you don't want to talk about your death.
Yes.
There's, and I'll make a book plug, but there's a book
yes,
called The Denial of Death by Ernest Becker that, he extrapolates that overall feeling of like uneasiness and weirdness around your death into probably all of the things that are the human condition, which is interesting.
Well, no, I do. I think this is kind of why this was so interesting to me. His publicist sent me his bio and, the request to come on the podcast. And I thought, like, this is kind of not really in the vein of what we do. But somehow it struck a chord with me because it just felt like, wow, this is actually encompasses exactly what we do in a way, just not in the traditional sense. But this is a lot about self-discovery and, living fully expressed and really embodying your highest self.
Yeah. And like what you said earlier, and just making the choices, living your life all the way to the end.
Yes.
This is that last step.
Exactly. Yeah. And in that way, it's really beautiful. And like, that's kind of where I really came to with this conversation, is just like, what a beautiful conversation to have. And what a wonderful gift you give the people left behind, to just give them this peace of mind and this sense of ease and grace. And, maybe you haven't lived gracefully, but you can die gracefully.
Yeah, for sure. And, worst case scenario, you talk about all of this stuff and it makes you a little more appreciative for your everyday life.
Absolutely.
Just like summing it up. And you're like, live in the moment. You're like, oh, all right, well, I just planned for my death. So that automatically makes it a little easier to be here now.
It really does. And it actually is something that Adam and I discovered because we really got serious about this before Africa, because it seemed like Africa was just as good a reason as any to get serious about, figuring all this stuff out. And, there's something about getting this taken care of that relieves a stress you didn't even know you really had.
Right.
It was like a deeply embedded sort of dark stress that you were like, oh, I don't want to look at that. That's like, let's just kind of ignore that, put that off in the corner. But once it was complete, it was like, wow, we feel so like, it's like this relief that you didn't even know you would experience.
Right.
Yeah.
Yeah.
So we hope you guys get a lot out of this conversation, and we hope that, if this is something you're struggling with parents or loved ones, maybe share the episode with them. Maybe it's a way that you can create that conversation and open the door to figuring out, how to make these decisions and how to communicate about it. And also he gives a lot of information about how to appease or how to ease your fears around what it means to have some of these advanced care directives online and filed away so that people can access them. So it's really a very, very informative and cool episode, but it's like kind of in a dark, cool way.
It's dark and cool. Sort of like your sleeping environment.
Or how your sleeping environment should be, right? So we hope you guys enjoy it. Without further ado, here's Dr. Akhtar.
And we're live. Welcome to the podcast, Adil.
Hi, thanks for having me.
Yeah, we're really I hate to use the word excited to talk about this discussion, but I think as we were talking about before we went live, this is such an important topic for people to really address. And I think that so many people are so preoccupied with living that they oftentimes don't really consider the impact that these, the end of life care decisions can have on their loved ones and on, sort of their parting days. So I'm so excited to cover some of this information. First of all, can you just give folks a little bit about your background and how you really got interested in spearheading this conversation about, advanced care and sort of end of life decisions?
Sure. So by training, I'm a medical oncologist. Meaning I'm a cancer specialist, and I've been doing, oncology and taking care of cancer patients for a long time. And since in cancer we see a lot of suffering and patient dying, I got interested in symptom management and palliative care and then end-of-life care. So in 2008, I took my boards for palliative care and hospice. So now I'm not only a cancer doctor, I'm also a palliative care and hospice physician too. I belong to a large group of doctors. We have about 400 physicians and a big oncology division. And I am the chief of end of life care for the entire group. I'm also a medical director for inpatient care at Karmanos Cancer Institute, Oakland campus. As you know, Karmanos Cancer Institute is one of the few comprehensive NCI designated cancer centers. So that's my background.
So maybe first of all, you can just tell folks what is advanced care and what are some of the things that one would need to consider when talking about advanced care or end of life hospice care planning.
Right. So I think we will have to differentiate between advanced care planning and end of life care planning a little bit. And I'll come back to this topic. Let me first talk about what advanced care planning is.
Okay, perfect.
So, to me, advanced care planning is a will. It's a healthcare living will. So, as we plan for future, we do our trust, our will, our financial planning. Similarly, we should be planning for our healthcare needs.
Mm-hmm.
So in my mind, advanced care planning is a healthcare living will, which we can do in any stage of our lives, young, old, any stage of our life. And the purpose is to tell our dear ones, our family, our friends, that in case if I am unable to make my own healthcare decisions, or if I get diagnosed with a serious condition or a terminal condition like advanced cancer, what is that I want to do as far as my healthcare needs go? So that even if I'm unable to make our decisions, I'm still in charge and in control of my healthcare needs, my life, and also my dying. So advanced care planning has basically two components. One is what we call a healthcare power of attorney, and the other one is advanced directive. So in the healthcare power of attorney, we assign one of our dear ones, again, who knows us very well, whom I would trust with my healthcare decision making and my life and death. And I will say that if in case I am unable to make my healthcare decisions, this is the person who is going to make my decisions.
Mm-hmm.
So that's the first part. The other part is what we call advanced directive, in which we basically say that in case if I'm sick and I'm unable to make my decisions, these are my wishes. So just to give you an example, if I'm in a terminal situation, would I want to be kept alive at all costs artificially? So do I want to have a breathing machine breathing for me? Do I need a feeding tube? Do I would go for dialysis type procedures? So I want to do it or I don't want to do it. I think that's a part of advanced directive. The other part of advanced directive in itself is it anything I want to say in addition to life-saving measures. So if I want to give message to my family and friends, in case if I die of my disease or accident, I can say that in advance directive. So this is a detailed document. It has to be witnessed and it has to be signed by uh, the person filling it, and then it has also to be signed by the person who has agreed to be the healthcare power of attorney.
Interesting. So I'm curious, if you do not have these documents in advance, how does the sort of hierarchy of decision making fall? Does it fall to next of kin, or how does that work?
So I'm glad that you asked this question, because being an oncologist, I come across this in the hospital every single day I'm rounding. So, let me just give you an example. Say we have a 75-year-old gentleman who has a advanced terminal lung cancer, who comes to the hospital with confusion or in coma, and we don't really have a advanced directive. We don't even have a healthcare power of attorney. If that person comes to the ER and we need to do the CPR to save life, that patient is going to get CPR and then end up on all kinds of machines and medications to keep him alive till the time we have a chance to talk to the family. So, being a physician, the first person we go to is the spouse or significant others, or then to the children or the first degree relatives. But in general, what I do in my practice is that I go to one person who's identified, but I try to do family meetings so that I'm able to communicate to the rest of the family and try to get a consensus on decision making.
And ultimately, is there, in terms of a legal sort of hierarchy, is there someone that it in the family or in the next of kin that it legally falls on? Obviously, in a perfect world, a family would come to a group decision, but I could see that oftentimes people would not agree. Is there sort of a way that it's delineated who gets to make the final decision if it's not already predetermined?
Then once there's a disagreement, we try to sit down with the family to resolve the decision making. But if there's an absolute disagreement, then the next of kin will have to go to the court in front of judge to get legal power of attorney to make the decisions, and that is a not a good process to go through, because that can take some time, and in the process, if the patient is suffering, the suffering is just prolonged.
Right.
Yeah, absolutely. I think that that's really a big important takeaway for people to understand is this idea about suffering and just the fact that by not having these things in place, you're just increasing the suffering of everyone that's involved with this experience. Am I correct in saying that?
Yeah, I mean, and that's why it's so important for all of us to make these decisions for us, so that it, first of all, it does not falls on the family, and number two, it's it's suffering, because the the breathing tube and the breathing machine is not something very pleasant. You
Yes.
suppose you have a terminal disorder, and there is absolutely no way of recovering from that. It's all futile care.
Mm-hmm.
And I'll uh, give you an example. A few years ago, there was a national survey done, where general population was asked, you know, in case of a terminal condition, would you want quality of life or quantity of life? And majority of the people said that they would want quality of life over quantity of life. And I think that's a very important point to make, that most of us in who are faced with terminal condition, or irreversible medical conditions, would want to be made comfortable and live the rest of our life in good quality, rather than spend the um, rest of our days in the hospital.
Yeah, and it seems when you put it that way, it seems so obvious almost, right? Like everyone would probably choose quality over quantity. But I think what people don't realize is that when you're faced with this decision, as the final decision maker, it's very difficult to decide for someone else, correct, on what they may want. And so we were just recently at a retreat in Rhythmia, and our listeners are familiar with the recent experience that we had. And one of the big things that one of our guests that was with us doing some tremendous healing on was having to make the final decision about taking her father off life support because he didn't have this delineated. And these decisions really stay with people. It's asking someone to bear the burden of that decision for you is a really big ask.
Yeah, I mean, and I'll give you my personal example. My uncle, who basically raised me, uh, uh, his wife, my aunt, uh, was terminal because of a end stage lung condition. She was on a vent, and we needed to make the same kind of a decision. So most of the children and nephews are physicians. Even then, there was a disagreement amongst the children, and it took multiple meetings to say that we should take the tube out. It's always better to have this clarity about what is it that we want to do, rather than push it over to the family. It's a very, very difficult decision.
So why is it, do you think, that most people, or I don't know if most people's the right word, but why is it that you think people don't have this in order? Is it that they don't know about it? It's not something that's just out there and in front that they should be planning for, or is there something else?
So I'll give you a couple of numbers. I hate to give numbers, but this is a very important question. So right now in our country, there are only 37% of the adult population who has some kind of a advanced care planning done. In people who are above 65, the number is a little higher than younger people. But the important point is the number remains the same in people who are well versus people who are sick with a chronic or serious condition. So there are multiple uh, uh, barriers from a general population perspective. I think you are right. Number one is lack of education, lack of awareness. So I think majority of us have heard about forming a trust, of financial will, other kind of financial planning. We have not heard about advanced care planning. Also, people who have a signed advanced care planning or advanced directive done, 70% of the time, the treating physicians don't even know if their patients have advanced care planning done.
Right.
That's number one. Number two, there's a tremendous denial about death. So none of us think that we are going to die. And
Which is so funny, right? Given that it's a guarantee.
because that is the only guaranteed thing in our lives.
Right.
By definition, when we are born, we are mortal. So we'll have to die. So nobody wants to talk about dying and death. In fact, I remember when I went for my first initial life insurance policy. So the agent was talking about when you will die, something will happen. And I felt really uncomfortable. I thought to myself, what is he talking about? I'm only in my late 20s. So nobody thinks that we'll get sick, we'll get involved in an accident, or we'll die. Number three, there is a tremendous confusion about advanced directive. So people think that if I opt for what we call DNR or do not resuscitate, which really is, if my heart or lungs start to function, I would not be revived. People think that if I do that or sign a paper saying that, nobody's gonna ever treat me for anything. So
Right.
confusion. And lastly, I think there's a cultural difference too. So studies have showed that minority populations have not really done well when it comes to end of life care discussion or advanced care planning discussion. So these are some of the factors from a patient side. Now, from a physician side, because I think this the discussion should be initiated by a physician. So this is such an important discussion that all of us should discuss it with our doctors. From a physician's perspective, again, there's a denial about our patient dying. Because by training, we are trained to save lives and not accept death. In fact, accepting death in our world is kind of accepting defeat. So there's
So true.
right because
Yeah.
doctors mean just treat. So there's a lack of training about these discussions. Also, physicians are busy, and these
Yes.
right? So lack of time on the part of the physicians. And you'll be surprised to know that Medicare has incentivized physicians by reimbursing the doctors to have this discussion. But the limitation is that the physician has to spend so much time face to face discussing this for them to get reimbursed. So I think these are few of the hurdles which we faced from both the sides.
So I'm thinking, for one, you sort of lump this in with financial planning and planning for the future. And, I think especially for young people, when maybe you're still getting started in your career and you don't really have a lot of financial planning yet to do because you're just getting started, you might not think about doing this kind of thing until you're older, or you're, sort of in that place where you're now doing financial planning, or you're planning for your kids' college, or you're getting, life insurance and that type of thing. But really, this is for anyone at any age, correct?
Absolutely. In fact, I have developed a online tool to do it, and I have named it Advanced Care Now, meaning whoever you are, young or old, you have to do it now. And that's my mission in life, to educate people to do the advanced care planning now.
So tell us a little bit about advanced care now. And I do want to get back to the end of life hospice care, but I do want to give people like some actual, like a way to break down these barriers that keep them. And obviously you've created this tool. So I'd love to hear more about that and how that's making it easier for people to really just get this stuff out of the way.
So Advanced Care Now, the URL is ADIR Now, ADIR now. And when I started to have this discussion, it's true that it takes a longer time. It's a difficult discussion to initiate. And if you look around, there is so much technology involved with keeping people alive, and there's so little innovation in this discussion of advanced care planning or end of life discussion. So I thought that we should innovate so that this whole discussion becomes easier to initiate, and the education part should be easier, because a lot of education or learning is now going online. The other problem with the Advanced Directive right now is that if I sign a paper, it's in my home somewhere.
Right.
Yes.
Right. So if I get involved in an accident and I go to the ER and I'm unable to make my decisions, the doctors will ask the family member or the healthcare power of attorney, where's the paper? And they'll say, he has done the advanced directive, but it's at home. It becomes pretty useless then. So
Right.
if we put it online, I think it will be accessible from everywhere. So it is a tool where a physician goes in front of the patient, says that, today I'm going to talk to you about this. Give them an iPad. It's a video-based educational platform. So a video will pop up. There is like a 4 or 5 minutes video on advanced care planning, the different components of advanced care planning. And then there are several videos for frequently asked questions. And then once the patient has seen all the videos he or she wants to see, the physician goes back and asks them if there are any questions. If not, they help them to sign the paper. So it becomes easier to initiate the discussion. It becomes easier to educate the patient, because what I've seen in my practice is that since I've started using the video-based platform, it takes me little or less time to complete the discussion.
Right.
So that's the platform basically. So we show the videos, and the form is online. We are trying to build an extensive database so that then if I'm a physician and want to see my patient's advanced directive, I sign in, look at the paper. If after a year the patient changes their mind, they can rediscuss it and again make the changes online.
So that was going to be my next question, because I was a fireman for a long time, and this was a problem that we ran into all the time in kind of the circumstance that you described, where somebody gets in a vehicle accident, potentially 7 states away from where they live, and nobody has access to this information. So what it's sounding like to me is that you, in doing this, it creates a database that not only a physician could look up, but maybe a family member would have access to their login or something like that to be able to pull up that information, which would be remarkably helpful.
Absolutely.
Yeah. So okay. If folks have this done, so for instance, Adam and I have this done, but again, like you said, it's on paper in our house.
Yeah, it's in a file cabinet.
Yeah. What's the best thing? Is it just literally to go to the website? Can the end user actually go and register and do this process themselves, or do you need the doctor as the medium in order to sort of legitimize this?
So it's really not a direct to consumer kind of a tool, because my firm belief is that this is a discussion which should happen between your doctor and you. So if you know about this, just go to your doctor, and then they can access the tool.
Got it. So this is really sort of instigating the end user to start having this discussion, because obviously, like you mentioned before, physicians are really not incentivized, almost de-incentivized in a way, to spend this amount of time creating this advanced care initiative with you. So really, this is a way for people to initiate the conversation and get doctors to start doing this within the practice even.
Right.
Awesome. So I know that we have a hard stop here in a few minutes. So I want to just quickly wrap back up to the end of life hospice care. And maybe you could just quickly delineate, obviously the advanced care initiative and what that's all about. But what are some things that people should consider with end of life and hospice care?
So advanced care planning can be done any time in your life. Hospice care is a end of life care discussion and end of life care management. So Medicare defines the end of life as a life expectancy or prognosis of 6 months or less. Although in special circumstances, it can go beyond 6 months. So if suppose someone has a terminal disorder, so since I'm a cancer specialist, I'll again give you a cancer example. So advanced cancer, say advanced colon cancer, for which patient has received multiple treatments and they're not getting better. Or at the time of diagnosis, patient is say 85 years old, had multiple other medical problems, and we don't really think that that patient is physically fit to go through any aggressive chemotherapy or any other anti-cancer treatment. Under those circumstances, when we have determined medically that there's nothing to be offered, then we initiate the discussion of end of life care, where
Mm-hmm.
we are not stopping treating the patient, because one of the major misconcept is that hospice is like a black hole where patients go to die. On the contrary, hospice, the main philosophy of hospice is that when you are not a candidate for aggressive treatment, or if you have decided not to pursue any aggressive treatment, then the philosophy changes to where we are more focused on improving the quality of life, improving the
Mm.
symptoms like pain, nausea, vomiting. And at that time, patients basically give over the medical care to the hospice physicians and hospice team, and then they are free to live their life. So when I talk to my patients about hospice, I tell them that look, we have tried, now is the next phase where we will stop the chemotherapy. We'll continue to treat you because you will have needs, but let us worry about the treatment. You are free of these worries now. Go enjoy your life.
Mm-hmm.
So that is the
Mm.
true mission of hospice.
Wow, I love that distinction. I mean, it really just paints such a beautiful picture because I think you're right. Most people think of hospice as a black hole, as you mentioned, and it's just such work of angels to come in and help people in those final stages of life. And just I want to just commend you for making this conversation just more accessible and just bringing it to the forefront of people's minds, because I think it really is easy for people to just put this stuff off. And part of living a life fully expressed is dying fully expressed. And I think that people, if they really understood that you can die graciously and within your own expression, that's a much more powerful and beautiful way than than this traumatic sort of exit that a lot of people are making by not having these details decided. So I just really want to commend you for making this conversation, accessible to people.
Yeah, and I frequently tell my patients that, you know, death is really a continuation of life. So we would
Mm,
have known what happens after we die. There won't be any mystery. Maybe
mm,
there is a life after death, and maybe, you know, the life after death is better than the life here. Then everyone would want to die. But,
mm. Yeah.
but I think we have, culturally and society wise, we have been so averse to talking about dying that, you know, it's it's a very, very uncomfortable discussion. I think
Mm,
in order to die gracefully, honorably, and on my own terms, I have to initiate this discussion as a society as a whole.
amen. I love it. Thank you so much, Dr. Akhtar. We really appreciate this. And I think this is such an important topic. We hope everyone out there goes to the website. And can you give us that website? We'll have it in the show notes, but can you just repeat that for us one more
Sure,
time for Advanced Care now?
It's Advanced Care now. It's ADIRNOW.com.
Perfect. Awesome. Thank you again. And we hope that people really listen to this and take some action on this. It's an important topic. And like you said, if we thought about death as a continuation of life and we thought of it in a more celebratory way, then just think of this as, planning your last party.
Right. It's been my pleasure. Thank you very, very much, Laura.
Thank you so much.
Thank you.
All right.
Bye-bye.
Bye-bye.
And that's all she wrote, folks. Literally.
Yes. It is literally the end.
It's literally the end.
We hope that you guys enjoyed that, or at least got a lot of good sort of talking points out of it, or food for thought for yourself.
Yeah.
And if you are getting a lot out of this podcast, of course, we welcome and love if you leave us a 5-star review.
Yes.
We are, we
On
live
Yelp.
and die by our 5-star reviews.
Yeah. Yeah, no, it's true.
Yeah.
And we're doing a little bit of living over here.
Yes.
Thanks to all y'all.
And just,
So-
hit that subscribe button. It makes such a big difference for us. We ask our audience for guests that they'd like us to get on the show. And, it makes us a lot easier for us to get those guests when we have more subscribers,
Yeah.
more reviews, all that good stuff.
Yeah, makes us look legit.
Makes us look legit. So if you want us to be super legit,
Like Katy Perry legit.
like Katy Perry legit,
Yeah.
scroll down in your feed, click subscribe, hit those 5 stars, and say, these people are super legit.
Yeah. That'll do it.
All right, guys, have a beautiful rest of your week. We'll see you next week. Bye.
Bye.